You guys ready? I think they're ready across the pond. All right, it is my great pleasure to introduce the U.S. Secretary of Health and Human Services, Kathleen Sebelius, who is joined by Brian Sivak, who's the Chief Technology Officer for Health and Human Services. Before I ask them to join me on the stage, I do want to thank Rebecca Mitchell, who is out in California expecting a baby at any moment, but who is part of Doug Fritzma's team and works with Brian to make this a reality, beginning last summer when we began these conversations. So I want to thank her and Doug and the team for working with Brian and everyone across the pond to see that this could come to fruition as the next stage in the great work that we will all do. Secretary Sebelius.
Well, good morning, everybody, and I want to start by thanking Karen, not only for that introduction, but thanking her from leaving the warmth in Louisiana and coming to join us in the frigid D.C. area. Today, as Karen said, we're also joined by HHS Chief Technology Officer Brian Sivak, and Brian's office really led the efforts that made today's MOU signing possible. It's a great honor for me to join again with my friend and a great global health leader, the Right Honorable Jeremy Hunt, Secretary of State for Health of the United Kingdom. And it's a great pleasure to be with all of you. Now, President Obama is committed to modernizing our healthcare system. He believes, as all of you in the room do, that digitizing records and data can save lives in addition to resources. Health IT is a critical platform. It's critically important to the goal of reducing costs. At the time, it's critically important to improving the quality of care that's delivered. And this really began well before the Affordable Care Act. With the President's signing of the Recovery Act in 2009, the Office of the National Coordinator has really been leading the way through efforts like Meaningful Use and the Beacon projects to transform the adoption of technology throughout the health system in the United States. And there's no doubt that incredibly significant progress has been made. Thanks to your work, more than 80% of our nation's hospitals are now using health IT in a meaningful way. Thanks to your work, more than half of the nation's doctors and other eligible healthcare professionals have also embraced the potential of health IT. And that's really a snapshot of the work that's happened just since 2009. And I can tell you, and I think Jeremy Hunt will echo this, that it is being watched all over the world because never has an entire nation made this kind of shift before. So what's going on here is really in the global spotlight. Thanks to your work, more and more patients are now able to obtain their own health information, which, as you know, can allow them to work more effectively with their doctors to improve their own care and have a voice in their care delivery. Now, I firmly believe that the partnership with the United Kingdom, which we're about to solidify today, will allow us to further this progress. Back in March of 2012, almost 2 years ago, President Obama and Prime Minister Cameron expressed a shared interest in collaborating in the information technology space. And as part of that collaboration, we began a series of annual meetings between the HHS and the UK's National Health Service that focuses on technology. Part of these efforts included our two departments zeroing in on topics like quality indicators and the uses of data, the adoption of digital health records, and priming the health IT ecosystem in both of our countries. And that brings us to the MOU we're here to sign. It focuses on 4 key areas: sharing quality indicators, liberating our lazy data and putting it to work, adopting digital health record systems, and priming the health IT market. And the agreement also lays the groundwork for an unprecedented amount of health data sharing as we align our data catalogs as well as our data sharing systems. So I'm looking forward to signing the agreement and hearing more as we go forward about the progress of this work. Now, I want to go back to the beginning, and I'd be remiss if I didn't mention how very excited we are at this particular moment in time to have the leadership of Karen DeSalvo, who may be new to ONC and HHS, but is a longtime champion of the shared efforts. Karen, as most of you know, did a remarkable job in the city of New Orleans, where she served as health commissioner and senior health policy advisor to Mayor Mitch Landrieu. On a personal note, I've known and worked with Karen for years on a whole variety of issues and watched her really lead the effort to rebuild the health system throughout a city that was devastated by the hurricane. She gained national acclaim for her work after Hurricane Katrina, and health IT has always been a critical part of her strategy. So she arrives at HHS and at ONC at a really historic period of time, and one that we're thrilled today to take to a global level. So we're thrilled to have Karen on board, and now I want to turn things back over to her. Karen.
Thank you, Madam Secretary. And now it's my pleasure to turn the podium over virtually to the Right Honorable Secretary of State for Health, Jeremy Hunt.
Indeed. Good morning, Kathleen, and it's a great pleasure to be talking to you again. You and I have one thing in common, that we're both the only people in our respective governments where there are no other politicians who are jealous of our jobs. That is something which I always remind myself in the most difficult moments. It's great to see you. It's great to see Brian too. It's the first time, Brian, I've ever seen you wear a tie, so that also says that this is a very special occasion. And before I go on to the memorandum of understanding that I'm very proud to be signing today, I just want to salute you, Kathleen, for what you're doing to bring universal healthcare coverage to America.
Thank you.
I think that statesmen and women are defined by the battles that they choose to fight, and this is an incredibly noble battle to fight. And I just want to give you some encouragement with the words of our greatest British statesman, Winston Churchill, who said that success is the ability to go from failure to failure without losing your enthusiasm. So I hope you never lose your enthusiasm for such an important battle. I think we have a lot in common, actually. We work very closely together on the global threat of antimicrobial resistance, and that is something that no country can do on its own, and we've had a very productive and important relationship, and I think we're making good progress. We've worked very closely on dementia. We had the G8 Dementia Summit in December, and I know that we're having follow-up events in the US, and that again is, I think it's the next big condition that the world needs to wake up to in the way that we woke up to cancer in the 1960s and HIV/AIDS in the 1980s, and we really valued our partnership. But I think the third thing that we really have a huge amount in common is that we are the two countries that are leading the charge in our passionate belief that technology and transparency can really transform healthcare. And you have, as you talked about, done some extraordinary things in terms of electronic health records in hospitals. We can learn from that as you go further down the road on that than we have. We've probably done more work in electronic health records outside hospitals for out-of-hospital care. And I think all of us now are thinking about integrated healthcare solutions, and so there's some very valuable work in common. We've just this year, for the first time for the whole country, published the outcome rates of all surgeons for the 10 major surgical specialties, so that if you're having your hip replaced, you can go online and look at the success rate of your surgeon compared to every other surgeon in the country, and we think that's going to drive up quality. And we're also excited to be working with you on things like decoding genomes, and I think when you think of the sort of the marriage of decoding a genome with electronic health records and you bring that data together, you have something that will be truly transformational. And I think all of this has really got one single purpose in mind, which is to put patients in in the driving seat of their own healthcare in a way that's never been possible before, and I think we share a belief in the power of that. So I'm very excited to be doing what we're doing today. I think you have some great technology companies and we have some great technology companies, and this is really about sharing that innovation and helping it to take off. I want to plug some great British companies like Patients Know Best. Talking Point, Patients Know Best is an electronic healthcare record innovation. Talking Point is for families living with dementia. And iBreastCheck is to help women get their breast cancer checks done on time. But I know you have lots of great companies too, and I think all of this is really about sharing and spreading that innovation. So thank you for making us both proud by allowing today to happen, and I think it will be fantastic for both our countries.
Wonderful. And so shall we do the task and sign the document?
Well, Jeremy knows that I was supposed to join him in the UK for his leadership on the Dementia Summit and then go on to the Global Health Security meeting. It was a time that it seemed unwise for me to go across the pond. So I stayed right here, but I heard it was a great success. Our team who went to the conference, and we do look forward to hosting you when you come back this way. And hopefully I won't live up to the words of Winston Churchill, from failure to failure. We've gone from failure to success, and we'd like to continue that on the way. So I think I'm about to sign our memorandum of understanding. And then Brian signs.
Okay.
The first time I was with Jeremy, just so you know, he came to the Datapalooza and was part of a great team from the UK who participated in helping to unlock some of our lazy data and got a glimpse of some of our great entrepreneurial genius who were in the room that day. So I think this is a great partnership that we can move forward on.
Excellent.
All right.
Thank you very much.
Got it?
Thank you, yes.
Okay, so thank you again, Secretary Sebelius and Secretary of State Hunt. It's great to see you guys again. And I want to thank both of you actually for your leadership in helping us to achieve this goal today. It's been a long time coming, and it's taken some effort to actually get us to this point. Actually, I do want to say it's pretty cool that I think this is the first virtual signing that HHS has ever done, and it's appropriate that it's at the Health IT conference. So hopefully this can be a new precedent that we're setting in this, times of fiscal tightness. We can do this in a good way. I just want to say that for those of you in the audience and virtually, you can find this MOU on healthit.gov. I believe it's already posted. If not, it will be posted soon. I also want to thank both of the teams from NHS England and the teams from the Department of Health and Human Services that have been working on the efforts underlying this MOU for the last 6 months. As the Secretary mentioned, this effort kicked off right after last year's Datapalooza in June, and we have spent a lot of time over the past 6 months really moving the ball forward in each of the 4 areas that this MOU undertakes. And so I know that it's really been great for me. It's been a personal pleasure getting to know everybody. I know the same is true for my counterpart, Tim Kelsey, who has also been very active in these discussions. And on behalf of all of us at the department, I'd like to express our appreciation for the work that the folks in the UK have done. And I'm personally looking forward to seeing the fruits of this budding partnership. Secretary of State Hunt, any final comments?
I'd like to pass over to Tim Kelsey, if I may, because he's been uncharacteristically silent to date.
Okay, Brian, can I just say, first of all, the work at this end has been actually orchestrated by Energy England and by our partners at the Health and Social Care Information Centre and the Department of Health. There are many people to thank, but I'd really like to thank Karen Hillier and Matthew Birkinshaw for their fantastic work in driving it at this end. So thank you to them, and thank you to you and to all your colleagues for making this happen. We will deliver some fantastic innovation over the course of the next 6 months, and we're looking forward to the Datapalooza and launching some of that then.
Excellent. Well, thank you guys very much. A hand for everybody in the UK. And I look forward to seeing you soon.